Hey guys, Shannon here, and we are back with Bobby Grubbs from Grubbs Counseling. He's going to answer some questions for us. We did a video earlier about frontline workers and the traumatic situations they've been in throughout this entirety of this long-lived pandemic. And now we're going to do a little bit of a follow-up about different ways that therapy and more specifically EMDR can help and resource and heal active kind of trauma situations, but post-traumatic situations. So looking down kind of into a future pathway when this is over and whatever that looks like, and how EMDR can really help heal all of that stuff that has gone on in the past long time. I'm like, I don't even know how long it's been, but it's been a long time. First, Bobby, start out just like, I know we did a video earlier with another professional about EMDR, but just give us a little bit of a refresher about like, what is EMDR?
Yep. So EMDR stands for eye movement desensitization and reprocessing therapy. It has been around since the 1980s, a little bit before as well, developed by Francine Shapiro. To date, it has over 400 studies that have shown that it's effective at treating trauma. It has 40 to 50, I can't remember the exact number, but like between 40 and 50 randomized controlled studies, which are like the gold standard, right? So kind of the cat's out of the bag on this. It's one of the gold standards for trauma treatment now. It's been endorsed by every single medical body that you can come up with, the VA, the CDC, the WHO. So it is one of the gold standard treatments for treating trauma. The other one is cognitive behavioral, TFCBT. It's been proven to show not only to desensitize traumatic memories, which we'll talk about here in a little bit, but also to reprocess them. So we talk about integration, right? So we want to be able to take this traumatic memory that maybe Shannon has with being exhausted from being a therapist through this pandemic, whatever traumatic memory she has, and we want to take those and integrate them with her positive neural network that she has, which says, I can do hard things, I'm capable, I'm confident. And we want to blend those two together. And then what comes out is this belief of, I made it, I survived this. Right. So integration is what we really like that EMDR does, is it helps to take these traumatic memories, desensitize them so they're not as disturbing to us, and then integrate them. The best thing I always love about it is that it doesn't take away what's true. So you may always look back at this work you've done as a therapist during the pandemic and feel sad about it. Mm-hmm. That's completely appropriate. That's actually a healthy emotion that is attached to this situation. So EMDR doesn't touch that. It only desensitizes the traumatic response that we have. So
yeah, and I love that kind of depiction of blending the two, because like if it wasn't desensitized, whatever it was, a lot of the reactions that we have is like, oh, we want to like keep this at arm's distance, we don't want to go close to that, like we're going to tuck that away and never look at that again. So that process that EMDR does, and maybe you can kind of give a little bit of a space of what that actually looks like, allows you to actually be able to get close enough to that thing to be able to blend it with something else that may be able to help it. It's just really amazing.
I love the way you put that, because I liked how you said kind of keeping something at arm's length or avoiding it, because that's one of the hallmark symptoms of trauma, right? We typically split trauma into like those 4 symptoms of avoidance behaviors, the physical memories and emotions that come with it, negative thinking, and then the I can't remember what the other ones are. But it's those 4 like things that we see with like PTSD. So the intrusive memories, avoidance in thought, feelings, and behaviors, negative thinking in our moods, and our change in physical and body sensations, right? So like the nice thing about EMDR is it takes care of the intrusive memories. It decreases the avoidance because we desensitize the person to the trauma. So when they recall it, it's not as highly charged as it used to be. So therefore they don't tend to avoid things. And then the negative changes in thinking and mood shift with that integration from that negative neural network to that positive neural network, which we'll talk about in a second. And then all that decreases the body sensations and the emotions that come with it. So it's that avoidance one is such a symptom that people forget about, right? Like we'll go with school teachers who've gone through such a exhausting time during this whole process, right? you know, they may just keep plowing through and plowing through and plowing through and lesson plan and making their Zoom video the best one they can come up with. And in doing that, what they're actually doing is avoiding being still because they're afraid they'll have a breakdown or cry. And so what EMDR does is kind of help prepare them for that. So the best thing, well, one of my things that sold me on it so much was that EMDR doesn't need a full trauma story. It doesn't need the whole thing, right? It just needs a couple things, right? And we call this like kind of phase 3, which is there's 8 phases to EMDR. So we have 8 phases and 3 prongs. The 3 prongs are past, present, future. And I love that about it because not only am I going to deal with the past times where this teacher might have felt, you know, abandoned or, you know, incapable of moving forward, right? But then I'm going to deal with times they felt like that in the present. And then I'm going to ask them, well, what if we have another pandemic, right? So I'm actually going to deal with future issues as well, too. So that past, present, future, that 3-prong approach to trauma really helps to kind of clear out any chances of possibly re-traumatization that could happen in the future. They'll be more prepared for it. So, yeah. And those 8 phases that we talked about, that access and activate, that phase 3 that we talk about really is where we just get the tidbits we need. So all I really need from a person, we'll use you as an example as we did the last video, right, with therapy, right? Let's just say that, for example, you've, you know, just had this moment where you felt exhausted at home and you couldn't go forward anymore and you just felt like I give up, right? I'm going to ask you for a particular image that represents that to you, right? Maybe that it's you sitting on your kitchen table, just your head down, like I can't do this anymore, right? And then your, you know, partner or somebody comes in, they need something else from you, and then it's just over exhaustion, right? And there's this belief, I can't do this anymore, right? I'll get the image, right? I'll get the emotions that you felt during that moment. I'll get the body sensations, right, that you had during that moment. So if you said, I felt overwhelmed, I'll say, where'd you feel that sense of overwhelmed, Shannon? And you'll say, oh, right here in my chest, I just couldn't take it anymore. Or my shoulders, I just collapsed forward and put my head down and said, I'm done with it, right? And then I'll ask you on a scale of 0 to 10, how disturbing does that feel to you when you bring that up right now? And you'll say, well, maybe a 7, right? It's still there, Bobby. And I'll say, okay, all right. Well, what does it say about you in that moment when you look back at that moment? And you'd say, I can't do it. I give up. I'll say, okay, all right. Well, switching gears for a second, when you look back at that moment now, what is it that you'd rather believe about yourself? What's the healthiest part of Shannon know to be true instead? Not that you believe it right now, but what would you want to believe? And, you know, we'll just go with Glennon Doyle, right? Maybe you want to believe like I can do hard things. Okay. So I'll say, okay, all right. Well, on a scale of 1 to 7, how true does that feel to you when you hear those words, I can do hard things? And you'll say, oh, 2, I don't feel it at all right now. I'll say, okay. And that's all I need from you to kind of get moving. So I don't ask about horrible details. I don't get a whole trauma narrative. And the reason for that is that adaptive information processing system, that AIP that we talked about last time, is almost like a trauma hyperdrive. So when I use what's called bilateral stimulation, whether it's hand movement or eye movement, or I tap, right, or any form of dual attention where I say, Shannon, focus on this trauma and focus on my hands doing this, that actually opens up your hippocampus and it gives us access to that trauma. And as we know, with the brain, it's pliable, right? Neuroplasticity teaches us we can actually shift and change the way the brain is. So it gives us the ability to go in there and start working on that trauma, and you will naturally go toward the positive. That's the best part about humans, is that we tend to move toward healing. So as I do the work with you, you'll start to have some connections and realizations with you being able to do hard things.
Yeah. Yeah. And that it doesn't take, I mean, I think lots of kind of stigmas toward therapy in general of like, I'm going to like repeat everything and go through everything and like re-traumatize myself or whatever it may be. And that's where EMDR and lots of other therapeutic practices are so safe that like, don't need all of that. Like, you know, all of that and you're the expert on your life. Like, so it makes it really the increased safety of the relationship and of the space that like, yeah, like this looks different for everyone, but like when the pandemic ends, like your life isn't going to stop throwing trauma at you or throwing things at you. So it's like the healing, the slowing down, like is so necessary to be able to be resilient and to be able to have these spaces for the future when life still happens.
Yes, 100%. And you know, we don't. The nice thing about EMDR is that we don't like even if I were to get this whole story from you about everything that happened, like that doesn't necessarily mean it's important to your healing process. And so what EMDR does, by doing that bilateral stimulation with you and opening up that hippocampus, you take me to where you need to go. If I were to look at your story and try to guess which part was the most traumatic for you, I typically get it wrong every time. You know where to go. Oftentimes it's not the car wreck. It is the fact that somebody told the person that they shouldn't have survived it. Like that's the traumatic part, right? With the frontline workers I've worked with now, it's that there's no end in sight. And so we desensitize to the fact that there's no end in sight, and that positive belief of like, I can have hope, right? Yeah. So I think that we don't need all that stuff. We just need a little bit, and your brain can do that. We trust this radical notion that your brain knows what it's doing.
Yeah. And it does. Your body and your brain very much know what's going on. Sometimes we've just got to help kind of move some things out of the way to be able to get there.
Yeah, I often compare it to like what we learned about childbirth, right? Like what we learned, like the more we got in the way of it, the worse we did. When we step back and let mommy and baby do their thing, it naturally turns out better. And I think with trauma, sure, we need some supportive services and things there, but for the most part, we need to let the brain do what it needs to do, and we get better outcomes. And we have, 500 studies and 40 to 50 randomized controlled trials that say, yep, that's right. Trust the body.
Yeah. Well, what else would you want to leave people with and our frontline workers in regards to just like healing post all these traumatic situations we've been through in the past long time?
Yeah, I would say reach out and talk to a therapist, reach out and talk to friends who've gone through mental health treatment, maybe, and reach out and talk to somebody who has gone through EMDR work. And just like you mentioned earlier, if nothing else, just to build your resiliency for moving forward. You don't necessarily have to start with the stuff you're going through right now, but maybe you want to start on future targets or future things that you bother you. We can start there too. I think the most important thing is just get out there and talk to somebody. This won't be the last one we experience. We'll definitely learn some things from this, but we need our frontline workers, both in the physical body part, the mental health part. So I'm speaking to therapists as well too. Get in touch with somebody and just start checking in and seeing if you don't need it. Some traumatic events are healed spontaneously, which is great. Other ones need a little bit more, encouragement and, just someone to stand there with you and hold space while you work on it. So, but I would say reach out, talk to somebody. And again, typically we have this inkling, right? We have this inkling that something's off, something's wrong. Trust that. Don't suppress it. Like you said earlier, don't avoid it. Sit with it, realize that it's painful, and that's okay. That's your body talking to you and telling you that it's not done with this yet and it needs to work on it.
Yeah. And sometimes, especially I'm thinking a lot of the frontline workers and teachers, like you mentioned, like who don't have a lot of other option but to keep moving forward because they have to work or care for their patients or whatever it may be, that like sometimes your loved ones or your partners are good people to be like, oh, noticing some things are off or something's going on. And when or if those things get brought to you, that it doesn't mean anything's wrong with you, or the defensive spaces sometimes that we get into, that it's just like sometimes other people in our lives are better at noticing when we're like on full hyperdrive and like dragging ourselves behind ourselves.
Yeah. They're our best mirror for the world is what I tell my clients. Like they're our best mirror. So allow those people to show you if you're struggling. And like you said, don't get defensive, but just sit back and, be curious. Be curious about it and check in with yourself. And if it feels true, then reach out and talk to somebody. Then one of the things I'll leave you with, I think, is that our community in Louisville has responded our mental health therapists have responded so strongly, so well. Your work, a lot of people's work who's helped spread the message. I think if frontline workers reach out, you will find flexible, dedicated mental health professionals who are willing to meet you where they can, schedule-wise, work-wise. So I think our system is ready to take this on, and we just want to put that message out there that we're here.
Yeah.
We're not going anywhere.
Yeah, we will be here. Well, thank you so much, guys. Remember, grebscounseling.com. Reach out to us if you want any assistance finding a therapist or anything like that. Mimicking what Bobby said, all the mental health professionals in Louisville are here for you, and Mental Health Lou is here to connect you to anything you need mental wellness wise. But yeah, thank you so much. Enjoy the rest of the day.
You too. Bye-bye.
Bye.